have a wonderful life, and I'm super, super lucky to be here. I'm so honored to be here, and I think I have 15 minutes on your calendar, so there's a seat next to my mom if you want to sit here. There's seats on the floor if you want to sit and hear my story. I'd love to share with you if you have time to listen. So I'm going to kind of walk around a little bit, but Ellen is taping me, so I want to thank you for letting me share a little bit about my story, and also how a Terry Broder Breast Cancer Foundation grant recipient helped to support me throughout my journey with breast cancer. I had the wonderful opportunity to walk a half marathon with my own oncologist last weekend, and it was amazing. There was an awesome, awesome group of walkers, survivors, supporters, family members, and friends who walked in honor of Terry and of Norma and others who lost their lives to breast cancer. And we really showed that we're strong men and women in support of men and women undergoing breast cancer treatment and supporting breast cancer research. We really walked for camaraderie and for fundraising, but also to support the physicians and scientists who improve care and treatment options for breast cancer patients and hope for a cure. I really came to admire the TBBCF Foundation board during the time leading up to the walk, just for the dedication, their hard work, their selflessness, and they've really given me a reason to admire the board and the foundation for all that they do. Dr. Hofstetter actually reached out to me earlier this year and asked me if I'd be willing to be nominated to be the honorary chair of the TBBCF walk this year. And I talked to my husband about it, and we kind of hesitated because he said, well, Joanna, you're really lucky. Like, you didn't have to have chemotherapy. You know, you were diagnosed so early, and you have a great prognosis, and are you sure it's okay if you go up and talk about breast cancer to women who aren't as lucky as you? And I thought about it, and I thought maybe he's right, maybe I shouldn't do this, but then I realized that even if we're stage 1 and we don't need chemotherapy, breast cancer changes us. And it really changed me, it changed my relationship with my husband, it changed my health now, it changed my exercise and eating habits, it changed me hormonally, it changed me physically, and it changed me emotionally. So I felt like I could take on this opportunity to be the honorary chair. So I'd like to tell you a little bit about Dr. Hofstetter. She cares for patients at the Smilo Cancer Hospital Breast Center, but she's also the co-director of the she's the director of the Breast Cancer Prevention Clinic and the co-director for the Cancer Genetics and Prevention Center down at Yale. She and I met when I moved back to Connecticut, and we started a surveillance plan for me, knowing that I was high risk for breast cancer. But at that time, the surveillance recommendations for people with my genetic predisposition were to start breast surveillance at 35. And she was doing clinical breast exams, and we talked about the guidelines, and I don't have a lot of women on my dad's side that were still alive, so somehow, and I honestly don't remember how it happened, we decided that I was going to start at 30 instead of 35. So I had a mammogram at 30 the year before I got married at the end of the year, and I had an MRI because we were going to alternate MRIs and mammograms. And she called me a couple days later. She said, you know, I'm not surprised, you're young, you have dense breast tissue, there's something on your MRI. She said, I want you to come back, we're going to do an ultrasound mammogram, you might need a biopsy. So I said, oh, in my head I said, I know what this is. She said, I'm very optimistic that this is nothing. So I go back, have an ultrasound, the radiology tech is there, the radiologist comes in, somebody else comes in getting ready to do a biopsy, and the biopsy was tough for them to get the breast tissue, and I had a feeling that that was a bad sign. So she called me a couple days later. Actually, I went in for an appointment, it was Good Friday, and she sat down and said, well, we have a lot to talk about. And that was it. And we were just joking about how I got a breast cancer binder that day. The binder saying, with all the different sections about surgery and chemotherapy and hormone therapy and fertility preservation and all the things you have to think about, and social support and support groups. And I went home that Easter weekend and I read the binder, and we cried and we took a walk, and my life changed. But I have Dr. Hofstetter to thank for going against the guidelines with me and really providing me with individualized care and saying, you know, let's just start your screening early. the guidelines for my mutation now are to start breast surveillance at 30. So that's changed since my diagnosis, but if we didn't make that decision, who knows when, how, or at what stage I would have been diagnosed, because I'm not yet even 35. And I really credit Dr. Hofstadter's individualized care because I feel like that's why I'm one of the lucky ones. And I think that's important to know because it's Dr. Hofstadter's research and the research of other people who are supported by the fundraising efforts of this foundation that really can give us hope for the future. So Dr. Hofstadter's grant was specifically to focus on novel techniques to advance prevention of breast cancer. And what she does is she looks at breast tissue from both normal breast biopsies and abnormal breast biopsies, women at high risk, women at normal risk, and she looks for biomarkers in the breast tissue to look at the age of the breast tissue and see if there are some women who have breast tissue that's aging prematurely compared to that person's age. And she thinks that estimating a breast tissue age or premature aging of breast tissue can help to prevent higher risk of breast cancer. And perhaps for those women who are at higher risk can consider taking preventive medication or even do preventive surgery to prevent cancer diagnosis. So it's incredible that we're supporting women like her, and I want to tell you that she actually does change lives like mine. And I want to tell you a little bit about this year's grant recipients. So there's a Dr. Arko Dasgupta from Seattle who's working on research that will prevent metastatic breast cancer. And what he does is focus on finding and eradicating tumor cells that escape from the primary breast cancer early in the disease and kind of lie dormant in other parts of the body until it develops into metastatic disease. And so his goal, is to find these dormant cells and use some targeted therapy to try to prevent metastatic breast cancer from coming back. The next grant recipient this year is Dr. Shang Sun from Massachusetts General Hospital in Boston. And Dr. Sun is working to find blood markers that can be used to help track breast cancer disease and also response to treatment in women with metastatic breast cancer. So being able to test their blood to see if they're responding to treatments. The last grant recipient was Dr. Adrienne Gromper-Walks from Dana-Farber Cancer Institute, which is also in Boston. And her goal with her research is to improve the quality of life for women with HER2-positive breast cancers by making the chemotherapy options less toxic with less toxicity and side effects. So this is the important research that's being funded. This time for the research is now. If we could fund 5 grants each year, just think of what the impact would be. If we could fund 3 grants every year for the next 20 or 30 years, think of what the impact could be. Seeing the research done by the grant recipients from Terry Brodeur Breast Cancer Foundation gives us incredible hope for the future, and hopefully for people like me. I'm painfully aware that not all women have a successful outcome like I do. I see patients at high risk for breast and ovarian cancer down at Smilo with Dr. Hofstadter and also with a gynecologic oncologist. I see women who are my age who have stage 2, 3, or even 4 breast cancer. And I know how fortunate I was to be diagnosed when my cancer was early. Ongoing breast cancer research really must be funded, science needs to be advanced, and treatments need to be found so no patients have an outcome like Terry or Norma. No more women die from this disease. Breast cancer wasn't really a part of my life until that surprise MRI result in 2005. And on the outside, I walk around and nobody knows that I've been changed by breast cancer. I didn't lose my hair. I don't look any different, but the changes are real. Surgery wasn't easy. Endocrine therapy isn't easy. Being a young woman who can't yet have children because of my medications isn't easy. Knowing I'll never breastfeed my children isn't easy. Nothing about breast cancer is easy, but life is good. And I'm lucky and I'm grateful to be one of the ones who is strong enough